West Coast too, so I can say that now. We appreciate you joining the PFCC Partners monthly Community of Practice workshop. If you wouldn't mind chatting in to introduce yourself as we wait to get started, your name, organization, and this is the season of gratitude. So something you are particularly grateful for today. Give everyone a moment to do that. And I'll start. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners and just happy to be with you today. I'm located in Sacramento, California, and today it may come as a surprise to those who know me, but I am grateful for the rain. I'm a big summer girl, but it just sounds so soothing and nice right now. So I'm really enjoying that. Oh, and Jean,
Oh,
grateful daughter is coming home from college today. Yay, that's always a fun time.
time with adult
Wonderful.
children is precious.
Sure is. All right, we'll keep those introductions coming, and we're going to go ahead and kick off right now. So again, thank you for joining us. We are recording today's session. It will be added to the PFCC Partners YouTube channel where you can find all of the community of practice recordings. We will be sure to share that link in follow-up and the link to this session in case anyone has missed it. We also do have live transcript available if if you need it, and if one of my co-hosts can help me make sure that that is on, that would be helpful. All right. So before we get to the content for our session today, which I am really excited about, I wanted to briefly introduce our organization. This is really what PFCC Partners is all about. We want to see a health system transformed into one that works with people and through communities as a partner in their well-being. We catalyze system improvements by centering that human experience of health, and we recognize the critical role that community engagement and patient family engagement must play for every effort at delivering health equity. We know that the US healthcare system is very complex. Its systems are difficult to navigate and even more difficult to change. And with this complexity, it makes it challenging for people to access care that aligns with their needs, their health priorities, and preferences. So, our organization believes that when a system that centers care and care processes on the person, there's potential to reduce this complexity and advance a culturally humble, equitable healthcare system. So, PFCC Partners open space for patients, family caregivers, and community voices, experiences, and perspectives to drive improvements in this complex system. We know that these experiences, people with lived experience, are a huge catalyst for improvement and systems change. The team at PFCC Partners has decades of passionate experience partnering with healthcare systems and leaders, engaging those with lived experience in their efforts to improve. So we work to open these spaces and create partnerships that allow for improvement. And the PFA network fills those spaces. The PFA network is an incredible community filled with impactful people, stories, and insights that fill those spaces with just that. Their lived experiences, all in an effort to advance improvement in healthcare. So today I am thrilled that our team gets to present the final Community of Practice workshop of 2024. So this session is a panel on panels, which is a mouthful once you start saying it. We will be talking about planning and facilitating patient-family partner panels. So I'm going to kick us off with a little bit of content. And then I will be passing it to founder and CEO of PFCC Partners, Libby Hoy, who will be facilitating a panel. And Libby, did you want to say hello and greetings to our participants at this time?
I do. Thank you so much for joining us on a Friday afternoon. I hope that you're all looking forward with a grateful heart to the holiday coming up. I know I am. I've been busy clapping and cheering for all of you who have introduced yourselves in the chat. I love seeing new faces and familiar faces joining us today. So thank you so much for taking the time out to spend with us.
Great. Thank you, Libby. And we will be meeting all of our panelists very shortly. All right, so here is our agenda for today. First, we're going to review the 9 dimensions of authentic community engagement. This is a product from a project that PFCC Partners is partnered on called Inspire. So want to share that resource with everyone. And then we'll go through some new information of what we call lanes of engagement. And we'll talk about selecting the right lane of engagement for your healthcare organization's project or priority. And then we'll get to what I'm most excited about is the panel on panels. Okay, so there's a lot of information on this slide, and this is something we will absolutely share and follow up. There is a full brief or blog on these 9 dimensions of authentic community engagement. So this came out of phase 1 of a project that we're on called Inspire, like I mentioned. And Inspire stands for Initiating National Strategies for Partnership, Inclusion, and Real Engagement. And the brief that I pulled these 9 dimensions from, it lays out concrete practices that healthcare organizations can adopt to bring each of these dimensions to life. So, from compensating people with lived experience to creating trauma informed spaces, you can learn how to build stronger connections and get genuine insight and advance equity within your communities. Um, so I think each one of these 9 dimensions resonates with me, but a few that really stand out to me every time I look at these and that kind of apply to the discussion that we're having today is one, integrated. Authentic engagement should not be an afterthought or a mere sign off after decisions have been made. Instead, it involves authentic partnerships with people with lived experience from the very beginning. So hearing and understanding perspectives and, hearing new ideas from that person with lived experience perspective from the beginning, and then integrating that perspective into projects or priorities that your health system has. Another one that really stands out to me is trust-based, which is the last but not the least. And that's because building trust is essential in authentic patient family engagement and community engagement, as it's all relationships. So, organizations must follow through on commitments and close loops with honesty and transparency, and recognize that past harms experienced by communities should be acknowledged and repaired when possible. So, when having conversations with patients and families who have had, some somewhat traumatic experiences within our healthcare systems, really hearing those and recognizing those and not dismissing those, because that builds trust. And trust is a big driver to have, tough conversations with patients and family caregivers. So it's really essential to establish that trust from the beginning while you're, planning for or facilitating patient family engagement activities. And would love if anyone, wants to chat in what other dimensions are really standing out to you. I mean, of course, diverse and inclusive, ensuring that when you're having conversations with patients and family caregivers and people with lived experience, that, your team is also representative of those voices that you are seeking to engage as well. And equitable, we talk a lot at PFCC Partners about meeting people where they are. So if that means, going to the community church or going to where people are accessing resources within the community to have conversations and truly learn about individuals' experiences, that is a huge part of being really authentic about community engagement. I wanted to stop, Libby, and see if there are any other reflections in the chat.
There are lots of people resonate. I think the whole nine dimensions is really resonating. We've got a lot of folks that obviously are have tiptoed into community engagement or patient family engagement in a variety of ways. So I think we've got, let's see, the integrated resources. I think really important, transformational and restorative, and the concept of trust. And for me, my concept of thinking about organizations as, how do I build trust with my community? We got that question so much. And it was really liberating to work with, hear from a team working out of UC Davis here in California that was working, kind of flipping the script and seeing what does it mean to be a trustworthy organization? So instead of trying to change people's minds, focusing on what we as an organization can do to be trustworthy, to be consistent in our messaging, to not just our messaging, but our actions, that we have good alignment and follow through. So those kinds of things. But I thought that was kind of liberating for a lot of organizations to think about. Instead of changing our community members' minds, why don't we focus on becoming a trustworthy organization?
Mm, yeah, definitely resonates with me, and I agree. I think it helps lower shoulders a little bit too, when you can think about that a little more broadly.
Right,
Great. Well,
right.
thank you for sharing, and thank you, everyone, for sharing your thoughts in the chat as well. I look forward to reviewing those later. All right,
Got an
so
active chat today.
awesome. I can't wait
Yep.
to catch up. Usually I do both at the same time, but I'm being focused today. All right. So at PFCC Partners, we've been thinking really broadly about patient family engagement. For a really long time, we had been so focused on supporting healthcare organizations to develop patient family advisory councils or patient family partnership councils. And while patient family advisory councils are such an important resource to healthcare organizations, we also recognize that sometimes they're not the most inclusive structure to engage people with lived experience and really hear their perspectives. A full-time working mom may not be able to attend a meeting at Friday at lunchtime. So we've been thinking about these different lanes to engage the patient and family caregiver perspective. So you can see on your screen these lanes, and I'm not going to go through each one, but I more so want to focus on, the commitment from the patient family partner or those that you're engaging and the level of effort from staff, because these are some kind of key decision points. So if your organization, you have a high priority to reduce readmissions, okay, let's look at what is the level of effort as staff that we can commit right now, and let's pick a lane. And maybe it is low, maybe you have a handful of staff that have time to interview patients who have been readmitted to learn from their experiences. And so, that kind of low effort, you can still actively engage patients and family caregivers in improvement activities. So, hosting a few interviews. And then we have some key points for preparation here as well: providing logistics, preparing staff to remove some of those defense mechanisms, and communicating the connection to that improvement priority to any patients or family caregivers that you will be interviewing. So we will share this out in follow up so you can dive in a little bit more, and then we'll talk a little bit about how to pick a lane, because it can be overwhelming. Like, oh my gosh, there are so many things that we can do. Where should we start? And it's really all about scope, and we'll talk more about that shortly. But we have added even more lanes to our lanes of engagement. So resource development, quite low level effort and commitment for both the patient family partner and the staff. So, learning together about what is information that needs to get out there and how can we provide information and develop resources for patients and family caregivers in a patient-centered way. Journey mapping is a fantastic way to learn about a patient's journey throughout their hospital stay, their emotions through each point, decision points that they had to make, where they were engaged in their care and decision making, and where they weren't. So it gives you a really big picture about where some of those opportunities for improvement might be throughout a journey map. And then finally, what we're here to talk about is patient family partner panels. And I'm super eager to get to our panels and panelists and learn more from them about what has worked really well in partnering specifically with PFCC partners in our unique way of planning patient family partner panels. So we'll learn more about that. But if you have other lanes of engagement that you have tested or utilized at your healthcare organization, or if you're a patient family partner and you've been a part or been engaged in a different way than what we haven't listed, would love to see, would love to grow these lanes so we can provide a really comprehensive list to healthcare organizations who are making decisions about, what's the best way for us to engage patients and family caregivers. And I'd like to provide a really fantastic example. Oh, Libby, should I pause? Are there
Yeah,
chats?
let's pause there and see,
Okay.
because I love this learning
Okay.
community, and I would love to see if anybody has other lanes that they want to add to the chat. And the other thing that I wanted to make mention, and you're going to get to this in that example that you're going to share in just a minute, but the other thing is to avoid thinking linearly. Oof, that's a hard
That's a
word.
tough one.
It Selecting one lane of engagement doesn't mean you can't change
Right.
lanes, doesn't mean that you can't use some of the lower lift activities to build the momentum for a larger lift later on, whether that be onto a quality and safety committee or perhaps onto a safety initiative. So not yeah, just recognizing, put your blinker on and change lanes and get another one and go over to build. The point is to find the differing and diverse perspectives that can really inform your quality and safety improvements.
Mhm. That's a great point, Libby. And I love the lane change reference too. But so we've been talking a lot about PFAC plus. So maybe your healthcare organization has a patient family advisory council, but there's a project starting over here that is really specific to a specific community or a specific diagnosis, and you need to broaden that perspective that you're hearing from. So you may jump in another lane for a quick second, do a survey or an interview, or invite people onto this team directly. So yeah, I'm just fully agreeing with that.
Awesome. And before we move on, Rebecca Johnson put in community data walks. And I am not familiar with what that concept, and Simi's
Either.
asking for it too. So Simi and I want to know.
I
Would
want
you
to
come
know.
off the mute and explain what a data walk is?
Oh, yeah, hiya. Hi, I'm Rebecca Johnson. I'm a community engagement researcher, and one of the things that the Urban Institute does community data walks. It does some really good ones, and you can present posters of data which is very meaningful to health clinics, health researchers. But then you can use those posters to engage communities, explain why those questions are important in big data terms, but then also get communities engaged with talking about that and sort of really unpicking it, and sort of you can ask people, well, what does that what does that look like to you? Translating it really in terms of the big data. But it's very nice to do it in person, or I've done it online as well, which is nice. So you do a whole series of presentations that way.
Thank you so much, Rebecca, for joining. That sounds really fascinating. I'm definitely going to look into that a little bit more. I also see a comment from Catherine about offering multiple options depending on how a person wants to be involved. Catherine, that's it. That's the
Yep.
whole kind of concept behind the lanes of engagement is to flip from, in recruiting and into the traditional PFAC, not in place of, but as an addition to offering sort of a no wrong door for engagement and allowing the person who's engaging to make that selection based on what they have time and capacity for. So love that you picked that up. That's awesome.
Yes. Love that. Awesome.
Lindsay, before you move on, I just see that Bruce mentioned lane governance opportunities, and that's one I'm not sure. I'm not familiar with that one either.
Bruce, do you want to
Bruce,
come
would
up
you like
and
to come up and explain?
Yes. Hi.
Thanks. Hi.
I'm with Peace Health in the Northwest and on a particular network. There's something called ACOs, Accountable Care
Mhm.
Organizations under Medicare. And I happen to be a Medicare representative on a board of directors. It's something that's physician-led, so the majority of the members are physicians. But there are two positions for folks like us. And when I think the reason I'm bringing this up is it's provided an opportunity to maybe not just focus on patient needs, although I'm on the quality committee, so kind of tangentially we deal with that. But I'm also a representative to our medical executive committee for the hospital. And we're recently just kind of being minimized, going from being in the beginning a kind of considered a member of that committee that didn't vote to now reporting only quarterly, only on Teams, not having a presence within the system. So I'm trying to figure out how to reestablish some of that deeper connection
Mhm.
to a committee like that so that we can have more meaningful relationships. We're talking about
Uh-huh.
relationships. So that's kind of where the thoughts are coming from, where the experience is coming from.
Yeah.
Thank you so much for sharing that. And you're right, we should hold space for governance as well
Yeah.
and focus on how we can do that really authentically. I really appreciate that. We'll continue to learn more about that particular lane of engagement and look forward to hearing more from your experience as well.
Yeah.
I
Absolutely.
think
Great addition.
Yeah, and if I could, I just opinionate for just a second on that whole concept. I think it really ties to how is the patient family partnership feeding the organizational priorities and really keeping in close alignment and integration. I think that's where we start to get more traction with governance. But yeah, curious if that is helpful to you.
Yeah. Great discussion.
Yeah.
And yeah, I really appreciate these additional lanes, and we'll continue to add these lanes. That's why they're not fitting on one slide anymore because there are so many ways to engage and be engaged. But I would like to do just a really quick example of picking a lane that works specifically for a specific priority and project. And so this is an example from Providence Mission Hospital. It's a fantastic webinar that is recorded and we have promoted before and will happily share it again. But Providence Mission Hospital, they were really focused on addressing disparities in sepsis care for patients with limited English proficiency. So where they started is they looked at data. So data really drives everything. So they had a goal of reducing the average length of stay and decreasing readmission rates for patients with limited English proficiency. So having that information, they held a focus group to understand the challenges. And what they learned was there were barriers in understanding the disease process for these patients, barriers in building trust. And then once they were discharged, they had that post-discharge care challenge because they didn't truly understand, those discharge instructions. And so what this hospital put in place was a sepsis, among other improvement activities. They also put in a sepsis nurse navigator program. So they utilized nurses who became qualified interpreters who could have conversations with patients who spoke other languages, especially Spanish. So the patients, had a better understanding about their disease process. They were able to build trust with someone who was speaking their language to them, and could also understand their discharge processes better as well. And so they ended up reducing length of stay for patients with limited English proficiency by 24% and decreased readmissions by 33%. And this was all through patient family engagement and specifically a focus group. So they looked at their priority, really specific area, really specific population of individuals. They chose their lane, which was a focus group, which is a great lane to choose because it was really focused on those individuals who had experienced sepsis who had limited English proficiency, and we're able to understand those gaps and implement improvements. So just a really fantastic example of, how this can work really, really well. So at this time, Libby, did you have anything else to add
Of course
there?
I did.
Yeah.
Of course I do. Because I
know.
think this is just such a powerful example. But you're so right, Lindsay. I mean, they looked at the data, they saw where the gap was, they created a listening opportunity to learn about it, and then they employed an intervention. A couple of other things I just wanted to point out. I think you said it at the beginning, but this hospital also has a very active PFAC. But
Right.
for this particular project, they needed a more intense, deeper dive into this particular population. So the PFAC then was able to, I think, contribute to the recruitment for that, but those members didn't have that lived experience. So this is how a great example too of how multiple lanes can work together, specifically around the PFAC. And then the other part that I really just love and want to drive home for all of you who are working with limited resources, which is everybody in healthcare at this point, um, they didn't they didn't acquire any new resources. They used staff that were already in place. They didn't have any expenditures. They had some staff training time, but really were already using people that were already in the environment were who stepped up for this. So really excited about that.
Yeah, absolutely. And you can keep rolling, Libby. I'm going to pass it to you to talk about, selecting the right lane.
Awesome. So yeah, we've created all these different ways. So how do we think about which lane is the right lane at the right time for the right project? So we've just been developing some questions around this opportunity, and I wanted to run through a scenario with you. So say that your team has been tasked with developing an intervention to improve medication management for your organization's patients. So lots of times this might come through as medication adherence or medication compliance. But I'm really going to encourage you to, from the get-go, think differently about how we define the problem and what do we need to know about that problem? What do we not know? There's always things we don't know. So what do we need to understand more about medication management? So thinking about that, we're going to engage patients and families who maybe are struggling with medication management. And so what's the right lane? Well, first of all, we want to think about scope because scope drives everything else. So the scope for this project then would be patients or patients in this organization who experience difficulty managing their medications. So is that a large population or a small population? It's probably a pretty good size. The second question you want to go to after defining your scope is, do you have ideas about what you want to learn from your patient family partners? Is this a topic where you already have some ideas about why this medication management is such an issue? Or are you really at the starting point of saying, gosh, I'm not really sure why our patients are having difficulty managing medications? Maybe it is a compliance issue, an adherence issue, and maybe patient education would be an effective way to go. But maybe not. Maybe there's something else going on, as was the case in a rural community we spoke with, who the organization was working on readmissions, and medication management was a critical piece of that whole readmissions sticky issue. And so we asked, what gets in the way of medication management? And this gentleman said, well, I was discharged with a cardiac medication that my local pharmacy has to order, so I couldn't get it for a week. So you can see that if we're open and we want to listen to patients and families, find out what's going on, what's underlying the data that we're seeing, then we can ensure that we're using those precious resources really diligently to solve the right problem, right? For that gentleman, a patient education on how important it is to follow through with their medication regimen wouldn't have been helpful. That wouldn't have solved their problems. But thinking with the community about how they can bridge that medication gap is a really effective way to move forward. So, what do you want to learn? Are you at the beginning, the middle, or the end of a project? This is really important. So if you're just starting out, it's a great time to engage patients and families, right? We always say as far upstream as you can get. But maybe you're in the middle of the project. It's not too late to have a listening session, to have a focus group, to learn what you can. Or if you're at the end of the project and you come up with a set of priorities, floating those to the patient family partners, it's important to think about. If you're at the beginning, you might think about engaging onto a committee or onto a project initiative. If you're in the middle, but you still have opportunity to shift and modify based on what you learn, that's still a longer term engagement lane might be right for you. At the end, you probably want to go with a one touch point. So something to be thoughtful about. And then who can help you? Aside from the patient family partners with that relevant lived experience, who else can help you in your organization? Do you have folks that are in the community more often than you are? Do you have others in patient safety that can really help describe and bring context to the patient family partners you bring in? And then where will you recruit from? Like, is that going to be really hard and you only have 2 weeks? Then maybe a shorter term engagement opportunity is right for you. So these are, again, just some of the questions you can ask yourself as you're thinking about which lane for your project at this time. Again, recognizing it's not just one lane to one project. You may, very well have a listening session, find that so valuable that you want to bring some of those listening session members onto your initiative or your patient safety committee. So let me know if I explained that decently or if there's any questions on that concept. How are we doing in the
Yeah, I'm not seeing
chat,
any
Lindsay?
questions. Just some agreement and, co-production is where it's at. Going back to
Yes,
redesign is a good thing. A lot about design thinking. So yes, yeah, lots of agreement with this approach.
awesome. All right. Well, I think that brings us to, oh, one more thing. It brings us into preparing for panels, which is the focus of our talk today and a chance to bring in some really great partners. So a few guidelines that we use at PFCC Partners. We typically think about panel size. How much time do we have really kind of dictates that. So 2 to 3 people if we've got, 30 minutes or less. If we've got more than 60 minutes, 3 to 5 people. So just being mindful that we want to have an opportunity for diverse perspectives, but also enough time to allow folks to engage. The prep session is critical for us. I don't know that we could do a panel without a prep session. One of the things that I think I've learned is having the prep session in close proximity to the event is really helpful for people. Lots of other things going on, so no more than 10 days out. I think ensuring that your panelists know who the audience is and perhaps why they're there, what is the motivation for them being present is really helpful. Objectives, of course, and logistics. Introductions to one another as panelists, I think, is really useful as well to increase the comfort level while they're presenting. And then reverse engineering. And this is something that I learned from my own experience in serving on panels where I had something so important I wanted to share with that audience, but the question just didn't quite allow me to respond in that way. So having some guiding questions of things that you want from the panel is really important. But so is during that prep session asking, you guys are experts. What do you know about this particular topic that you think this audience needs to hear. And then we'll design a question to elicit that response. And then preparing bridging comments. Sometimes our patient family partners have a relevant experience, but the staff who are listening may need a bridge built from that experience into the focus that they're working on. Panel agendas are really important, and time for interaction among panelists if possible, and question and answers if questions are have an opportunity to be filtered in some way. I think we're always a little protective of our patient family partners and recognizing they're sharing their personal experience. And so again, getting asked myself more detailed questions about my son's diagnosis is not really a great important place in a panel. So wanting to be able to filter those. All right, now we're going to get to the good stuff. And the good stuff is our wonderful panelists. And I am going to ask Lindsay to leave this slide up so that people can read where people are coming from. But I want to dive right into the questions because I think I've taken too much time. So if I could start with Miss Beverly Rogers, thank you so much for joining us. If you would introduce yourself, Beverly, and just talk a little bit about what strikes you as important in the way that PFCC Partners prepares for panels. I know you've been on a lot with us.
I've been on a lot with you, and let me say that the reason and I think I came to you, Libby, and asked if I could be on your panel, didn't I?
I think so.
I approached you because what I look for on any panel, and I think most of us who are really out there to be advocates, is I'm looking for what I can add to that panel. What can I add? And you talked a lot about trust. Trust is the foundation. If I don't trust you, whether it's with the doctor, whether it's with the system, whatever. So that is the foundation. And I trust PFCC. I trust you with my information, and I trust you to hear me and to move on and do what needs to be done. Let me say one other thing, and I'm going to stop, I promise, Libby. I have been on both sides. I worked at Michael Reese Hospital, Cook County Hospital, the American Hospital Association, Wyoming National Breast Cancer Organization. So I've been on the administrative side of it. And now that I'm into Medicare and all of the other things, from Jim Crow to Black Lives Matter, I'm on the patient side. So I think for me, when I look for a panel, a really good organization to talk with, I want to make sure that we're looking at ways to bridge the gap. And I think that's what PFCC is doing, looking at ways to bridge the gap.
Thank you so much, Beverly. I really appreciate that. And Beverly, you are just such a valuable part of our PFA network community members. So thank you so much for joining. And I know you'll have more to add in a little bit. Bridget, how about you? You know, when you and I started working together, we were kind of like, oh, we were in different environments and we really had to work at that. What's important for your background in terms of our process?
I think, well, when we started working together, Libby, I was working through Bazell on a support contract for the Quality Improvement Program. And so we were working with the Centers for Medicare and Medicaid Services and CDC and sometimes Sepsis Alliance to develop webinars, of which you were a part of those webinars and bringing the patient perspective. And I think we had a little bit of tensions between, you know, a need to have finalized presentations 3 weeks in advance and really wanting to bring in the authenticity of the patient story in a way that didn't seem scripted. And so I think we were able to sort of strike that balance by really focusing on having clear goals and objectives for each session that were shared, understanding each other's process and timelines, and then looking at how we could marry the two, and then developing trust with our customers and the sponsors of our webinars by having you provide descriptions of the perspective of each of the patient advocates that would be participating, working collaboratively on coming up with some questions, which then you very eloquently worked into your reverse engineering process, but we were able to allow the sponsors to be part of that. The preparatory session, as you mentioned, was critical, and then we even had a dry run that our sponsors participated in. So by the time we had the events for the quality improvement organizations, I think our sponsors were feeling very comfortable with the direction of where we were going. And it was still an authentic story that I think was helpful to, really, we had a lot of data, but putting a face to the data and really advocating on behalf of patients and family members. And I guess the only other two things that I would want to mention is the patient partners did a great job of also participating in the discussions. And I think what helped make the sessions really interactive is all of the meeting participants received discussion questions in advance and were asked to come prepared and share their perspectives as well.
Thank you so much, Bridget. There was so much in there that we worked through and really with that foundation of mutual respect and an ability to recognize the context with which we were developing a panel, right? And that's really important. You have to be mindful of the organization that you're establishing a panel for and the goals and the context for that work. So I really appreciated your team's steadfastness in working with us so that we both learned and came to a great conclusion.
It was a great experience.
For us as well. All right, Melissa, I know your colleague Carrie wasn't able to join us today, unfortunately, but I'd love to hear from your perspective, sort of, again, what strikes you as important in our process, the PFCC Partners process for preparing panelists?
Thank you so much, Libby and PFCC Partners for the opportunity. And I can, piggyback on what Bridget just shared with all of us here today. It's been such a seamless process. We have very much mutual values, and our mission and our vision and the work that we do and our quality improvement efforts really align with PFCC Partners. I think what makes this partnership so special between the California Quality Collaborative and PFCC Partners is just the fact that we work in a manner that's, that really builds on each other's strengths. We are very transparent. I think very early on, Libby, we shared with you that some of the challenges that our partners are experiencing as far as who the learners are and the fact that it might be challenging for them to advance a quality improvement intervention at a specific primary care practice. And sharing that early on, being transparent, having this mutual trust really has been, a very wonderful opportunity for us to really work on who would be that ideal patient panelist to serve on a specific event, right? And this would be a patient who can resonate with our learners. And that's been truly a very remarkable process, one that I very much appreciate. And I think it's important to keep in mind as anyone decides to advance similar work in assembling a panel. Know who your learners are, share that early on. And that's what we did. And I think that has led to a very fruitful and successful series of events.
Thank you so much. Yeah, I think it's all about just humble learning, right? Coming to all of these endeavors with a spirit of there is something to be learned for our organizations, for our patient family partners. And I kind of want to ask a question and open to any of you to answer, but I'm going to direct it at Beverly initially. Beverly, you've served on some panels that have had some fairly sensitive topic areas. And we've established panels for behavioral health. Bridget and her team and us did one on opioid use disorder recovery. And so how do we get to helping patient family partners feel comfortable, confident in those really sensitive conversations?
I always do the C's. clear, concise communication. That doesn't mean always texting. I know it's popular. That doesn't mean just emailing. I am a less talk person, a conversation person. And if you're looking for something in particular, you need to talk to the person. You need to talk to me and tell me what it is you're looking for and how I can help you, because it's listening on both sides. And I think that's what's worked. And I especially want to give kudos to Lindsay, because Lindsay is a good listener. But it is the communication. You've got to have good, clear, concise communication. If you're texting or emailing and it's something personal, you may run into trouble. And, because everyone has a different perspective or different understanding of what it is you're trying to say. So those are my recommendations.
Fantastic. Thank you, Beverly. And Bridget or Melissa, I'm curious if either of you have anything to add on that subject of engaging people on really sensitive topics.
I think Beverly said it from my perspective, having been on the other side of it and working with you to through your network find patient partners, Libby. I think that you had a great understanding of who our audience was and what the needs of each presentation were, and then we're able to find the right people and develop that trust. And from my perspective, we're very respectful to the patient partners and what their needs were, as well as what the needs were of our audience and us as an organization and our sponsor.
Yeah, I guess that really speaks to meeting people where they are, right? And that's
Yeah.
everybody involved, the organizations, the sponsors, the patient family partners, and really being clear, Beverly. I think that's a super important component. Melissa, anything to add on that one?
Libby, real
Oh,
quick, I saw in the chat someone said were the 4 C's. The fourth C, for especially for your learners, for anyone that is working, is calendar.
ah, yep,
Because you guys don't just work on the one thing. In the
right.
hospital, you're working on everything, but you cannot assume that because we are retired that we don't have more than one thing. So the fourth C would be calendar.
I love that. I don't know how much time we spend on calendars, but it's a lot because you really you do have to kind of build those bridges. Thank you, Beverly. Melissa, anything to add?
I will just say that, this engaging with patients, especially in that space that you just described, just remembering that when you engage patients and their families, think about empathy, think about the dignity and the respect. Those are critical elements as you approach patients, their families, and even their broader community. And so those are very key elements to always remember and ground yourself as you begin to form your engagement strategy, whether it's reaching out to a physician at a specific practice or hospital that may have direct connection with the group of patients that you're hoping to invite and welcome into your space.
Mm. So important to articulate that, Melissa. And I don't know anyone who has a team that's more focused on leading with empathy. The CQC team is just so good at leading with that, and it really does invite people in, even in vulnerable spaces, I think. So, wow, really great. Well, before I open it up to questions from our participants, do any of the three of you, anything else that we missed that you'd like to add?
One piece where you talked about the example, where you talked
Mhm.
about medicine management.
Mm-hmm.
When we're talking about choosing a lane, just because you're choosing medicine management does not mean it is one lane. For me, as a patient, I see medicine management come to play in admission all the way through my hospital stay till we even get to discharge planning. So don't get discouraged if you pick medicine management and find out that you have a lot of details and pieces to pull out. Um, you've got a lot of work to do. And I think as a patient partner, for me, the listening, the discussion, the whole conversation, and then during the planning and the activity, I need feedback. Don't
Mhm.
forget to tell me how we're doing. And I think that's the other thing that PFCC has done very well. You've told us how well we're doing or what we're doing or what's going on. And we see data or statistics that says this is what your voice added to that particular activity.
Great point, Beverly. Yeah, it's super important to come back and let folks know the impact that they've had. Um, and I think that your earlier comments really speak to the fact that what we say around here all the time is that data tells us what's going on. People tell you why that's happening. And it's really important that we listen to the people, patients, family caregivers, frontline staff, others who have direct experience to really understand so that, again, we're solving the right problem. Nobody has time or resources to waste on solving the wrong problems, right? So thank you, Beverly. Melissa or Bridget, anything else to add?
I'll go back to the previous slides with lanes of engagement. I've been dissecting that document quite frequently lately, and I appreciate it, PFCC Partners. Thank you so much for sharing that. And every time I look at every lane and I envision how you can go from one lane to another, and this includes a panel, just one thing I have to remind myself is that no matter which lane you select to engage your patients, the families, the community, each lane has a story. Each lane has a powerful story. And stories is how you learn from people. And those most precious individuals that you want to transform their health are those patients that you are welcoming and inviting. And I use those words very deliberately because we're not recruiting, we are inviting them. And so going back to my three key words, doing this with empathy, dignity, and with respect at all times. And I think another piece to the lanes of engagement or a panel, if you ever do decide to create your own or host one, is that, you're giving people with a voice, people with a story, an entry point where they feel validated, they feel like they're contributing. And so definitely that is an approach that I have taken in the years that I've been doing this type of work.
Thanks so much, Melissa. Really, really important points to consider all the way through. Bridget?
I guess the only piece I could add there, Libby, and I'm thinking about Providence Mission Hospital, since they were a presenter on sepsis at one of our panels, I think on health equity. I think what was sometimes hospitals or nursing homes, healthcare providers can feel vulnerable in terms of sharing data up front about where they're not doing well. And what I thought that they did in an interesting way is they didn't necessarily share the data up front. They just invited limited people who had limited English and had experienced readmissions or long lengths of stay due to sepsis in the hospital to share what their experience was. And that might be a more comfortable way for a healthcare organization to draw panelists in, and they did it in a really engaging and I like Melissa's words about empathy and your words about meeting people where they were, and that was they really set it up in two separate rooms where they just had Spanish speaking happening in one room with the patients, and then a translator and others listening in another room so that they weren't interrupting the flow of conversation. And again, I think that was a good example of meeting people where they are.
Yeah, that was so respectful. Talk about dignity and respect. I thought that was just phenomenal. So, yeah, thank you so much. Well, I think we do have a few minutes. Lindsay, are there any questions in the chat, or does anyone want to speak up?
I'm seeing one question in the chat about, keeping presentations or PowerPoints simple when used in panels when PowerPoints are included. So any uh, experience on keeping things simple? And Karen, I hope I did your question justice. Okay.
I'll open that up to our panelists. Any thoughts on that?
I have a question for the question. Do you want the PowerPoint simple, or do you want them so that people will remember them once the presentation is over?
Really
And
both, Beverly.
I think that's key. I tend to remember those that have people rather than just numbers.
Yeah, yeah. I'm presenting to a medical organization and it's going to be an online session. So you have no interaction with the audience. It can be up to, an hour. You don't want them to come in and then move out. I want to keep them engaged. I too like including pictures because it gives you more of a thing, but sometimes I'm so energized, I put too much in. That's why I try to back it off to keep it simple for the interest of doctors. You got to keep the doctor's interest.
Yeah. Challenging, but good question, Karen. And Bridget or Melissa, any other thoughts
Well,
on?
from my perspective, I always think of death by PowerPoint. So avoid putting every single word that you're going to say on a slide and really just focus on the main points. And then you can elaborate on those in the conversation. So just put on the slides what you think will be meaningful for people to take away and remember and focus their attention.
Thank you.
Awesome.
I
Melissa?
would recommend an interactive component if there's one, perhaps a poll or some activity of sorts to ground the audience. I'll perhaps maybe even complement it with an index card, a printout of key points from your presentation. I know physicians love those. They carry those in their pocket quite frequently, a half pager. That could be, but I know it's an online one, so there you go. That's the problem.
Yeah, and it can be reviewed after the event, and it's going to be viewed around the world.
Right. There's some great suggestions in the chat as well for you, Karen. Yeah. So great discussion. Yeah. You have a question, Libby?
Nope, I was just gonna wrap up and
and
hand it back to you to close us out. But my deep gratitude to Melissa, Bridget, and Beverly for joining us, for preparing for this session with us, and for the work that we get to do with all of you. It's just such an honor and a privilege, truly, to continue this learning community. We don't have all the answers. We're just sharing what's worked so far, and I think that I love this learning community. So thank you so much for lending your experience and your expertise to the discussion today. And with that, I will turn it back to Lindsay to close us out.
Yes, I echo Libby's gratitude for our panelists today, Bridget, Beverly, and Melissa. Thank you so much for participating. Your insight is truly respected. So thank you so much. And thank you to all of you who have joined us on this Friday afternoon before a Thanksgiving holiday week for some of you. So just really grateful, again, like Libby said, for this learning community. And again, I can't wait to go back through the chat and see what everybody was talking about when I was presenting. So yes, just lots of gratitude for all of you. So thank you. We will post this recording on the PFCC Partners YouTube. We are on Instagram, and actually we should update that. We have the PFA network on Instagram now too. So Patient Family Partners, join us there, and you can always stay caught up with what we got going on LinkedIn, or just email us. We are open to ongoing conversations about panels and providing additional resources and support for all of you. So we'll follow up with some of these slides as well to just continue to grow your thinking about all of these lanes and how you might engage patients and family caregivers in them. So with that, I will close this out and just say thank you again. And I hope everyone has a very happy Thanksgiving and a happy holiday season. This is our final Community of Practice workshop of 2024. So thank you for being a part of it and for joining all of them throughout this year. It's been a great year. So thanks everyone.